Role of the practical nurse across a continuum of care for aging adults. Many older adults prefer to live in their own home. About 28% of non-institutionalized older adults lived alone, and this includes more women than men. About 2.2 million grandparents over age 65 or over lived in households with grandchildren present. There are an increasing number of multi-generational households. Approximately 3% of adults over age 65 and 9% of adults over age 85 live in institutional settings. Older adults still need to feel needed. They want to stay involved with others. However, social isolation can grow, especially in those people older than 80. Most older adults live with a spouse or alone. Older individuals often try to keep their homes despite the physical or economic difficulties in doing so, because it represents independence and security. However, some older individuals will remain in their own houses and refuse to give them up long after it's safe for them to be alone. Families, healthcare professionals, and social service agencies may have to step in some instances, this is done to protect the welfare of some of these aging individuals. It's important to be close to friends, church, and in familiar surroundings with the older adult. The thought of moving can be overwhelming and involves giving up personal possessions, and that can be very emotionally traumatic. One type of choice that older adults may have would include independent or assisted living centers. These combine privacy with easily available services. Most consist of private apartments that are purchased or rented. They may also have restaurant style dining available for additional fees. There's different levels of medical, nursing, and personal care services that are available. There may also be some assistance with hygiene, routine medication administration, preventive care might also be available. Many facilities do have communal areas for residents and offer transportation services. There's also the life lease, or life contract facilities. For a large initial investment and substantial monthly rental and service fees, older persons or couples are guaranteed a residence for the remainder of their life. Independent residents will occupy apartment units, but extended care units are attached to this apartment complex or located nearby for residents that require skilled nursing services. When the occupants die, control of the apartment will revert to the owner of the facility. However, there's less wealthy older adults and they have fewer housing options. If these older adults meet certain financial standards, they may qualify for government subsidized housing. These might be simple apartments without any special services, or they may have some limited services, such as access to nursing clinics and special transportation arrangements. This type of housing is in high demand, so waiting lists of up to 2 years can be very common. Now, there are other options, such as two or more unrelated people actually sharing a house in which they have private bedrooms, but they share the common recreational and leisure areas, as well as the tasks that are involved in home maintenance. In some cases, a large house might shelter 10 or more residents. Roommates are selected so the strengths and weaknesses are going to be offset by some of the other strengths and weaknesses of the other roommates. In some instances, they may even have younger adults be included and they will help assist in some of the needs of the older adult for a cut in their rent. A community-based residential facility uh, provides services such as room, board, help with activities of daily living, assistance with medications, yearly medical examinations, information and referrals, leisure activities, and recreational or therapeutic programs for a monthly fee. Most of these facilities provide private or semi-private rooms with community areas for dining and socialization. And then we have nursing homes or extended care facilities. This provides more extensive assistance, such as room, board, personal care, medical, and nursing services. They're licensed by individual states and regulated by both federal and state laws. There's 3 levels of care in these facilities. Skilled care, where you have medication administration, skilled treatments or procedures, and services from specially trained professionals such as physical therapy, speech therapy, occupational therapy, or respiratory therapy. They also offer intermediate care where professional care is not required on a daily basis, and custodial care, where non-skilled personal care just provides assistance with some of the ADLs. Subacute care facilities provide comprehensive inpatient care for individuals that have acute illness, injury, or exacerbation of a disease process. They require less than acute care skills, but more than the skilled nursing care. And then specialty care facilities that may include hospice, dialysis, care for individuals that have memory loss, or long-term care for individuals with spinal cord injuries. Typically, the older adult wishes to remain at home for as long as possible, which may require additional assistance. Some of that assistance can come from family, excuse me, but some interventions may require specialized caregivers. More than 12 million people in the United States require home or hospice care, and most of those people are over the age 65. Home health interventions can promote health while helping the older adult maintain the highest level of function for as long as possible. The level of assistance required is going to differ and is likely to change with time. They may only require assistance with transportation or some household chores, but some of the more infirm clients may require assistance with their ADLs. Clients that have cognitive deficits are going to require supervision for safety and help with medication preparation, while others may require wound care or pain management. And hospice and palliative care can also be provided within the home. Assessment may require a registered nurse or social worker to determine what assistance is required. Services are best delivered by a team that includes RNs, LPNs, health aides, housekeepers, dietitians, and social workers, as well as occupational, physical, and speech therapists. Nursing supervision of unlicensed personnel will also be critical for safe home care. Most unpaid caregivers are going to be family or friends of the older adult, or they may be volunteers from a church or other charitable organization. Primary caregivers provide for most of the day-to-day needs of older adults, while secondary caregivers help intermittently with activities such as shopping, transportation, and home maintenance. Most caregivers are going to be female. If you look in your textbook at box 4.3, you're going to see services that may be provided for the older adult. Nurses and other professionals need to be kind to unpaid caregivers to help recognize the value of their service and also provide positive feedback, developing that positive relationship with them. These people can be invaluable in the care of some of these clients. Now, a paid caregiver is almost any type of home health help, and that can be arranged from the simplest to the most complex client needs. Many of these people are going to be from a highly ethical organization that provides a valuable service to older persons. However, there are others that are less scrupulous and they may even increase the risk for a vulnerable older adult. So it's always wise to check references before hiring anyone to work with the older persons. Also, consider an introductory visit and trial session to help determine compatibility. If you look at box 4.4 in the textbook, it provides some questions to ask when selecting a home health agency. There are some different groups that are available to help out caregivers that may want or need to share their experiences and frustrations. These people have started forming support groups to help each other cope with their stresses. Support groups allow caregivers to share their feelings and learn new strategies for improving their coping skills and also help combat caregiver isolation. And respite care is another option that allows the primary caregiver to have time away from the constant demands of caregiving. And this decreases caregiver stress and the risk for abuse. It gives the primary caregiver the opportunity to attend his or her place of worship, go shopping, conduct personal business, obtain medical care for themselves, and participate in other activities that most people take for granted. Respite care can be provided by family members, volunteers, or different agencies. Nurses should encourage caregivers to protect their own health and well-being by regularly taking advantage of respite care. Nurses tend to focus on physical needs, cares, and treatments and forget that the older adult are people. We can easily lose our perspective of the older adult as both a person and a member of a family. When family members show interest and concern for the older adult, it does allow nursing staff to increase our understanding and appreciation of our clients as people. And unfortunately, we do have some other older adults that rarely have family members visit. Family dynamics are going to influence the level of family attention for the older adult. Most families are going to fall in between extremes of attention. So either they don't come and visit or they visit very often. Most families will be in the middle. Nurses need to examine stresses that affect the family to best respond to the older adults and family needs. And most importantly, nurses should never judge. Um, Family doesn't come, family does come. Are there extenuating circumstances that may prevent them from paying a lot of attention to their loved one?